Picture this for a moment. It is 6:30 in the morning. You shuffle into the kitchen, still half asleep, and you reach for the same little plastic pill organizer you have been using for years. Monday, Tuesday, Wednesday, tiny compartments filled with medications and supplements that have become part of your routine. Blood pressure pill, cholesterol tablet, maybe something for diabetes. And right there next to them sits a bright red vitamin B12 capsule. You take it confidently because you have been told over and over that B12 is good for energy, good for the brain, good for memory, good for aging. You have heard that after 60, your body absorbs less of it, so taking more feels smart, responsible even. But what if I told you that for millions of adults over the age of 60, that exact morning routine may be quietly damaging the very organs they are trying to protect? Not overnight, not dramatically. No flashing warning sign, no sudden pain in the chest, no alarm bells. Just silent damage happening deep inside the body while everything appears normal on the surface. And here is the frightening part. Most people would never suspect their vitamin supplement because the symptoms arrive slowly. A little more fatigue, slight brain fog, heavier legs when climbing stairs, a strange pressure in the chest that comes and goes, forgetting names more often, feeling winded more easily. People blame aging, but sometimes it is not aging at all. Sometimes it is the interaction between vitamin B12 and two very common medications that adults over 60 take every single day. My name is Dr. Bianca, and today we are going to talk about something that almost nobody explains clearly enough. Because the truth is this, vitamin B12 itself is not the enemy. In fact, B12 is absolutely essential for nerve function, blood production, memory, and heart health. The problem begins when B12 enters a body already altered by certain medications. That is when the chemistry changes. That is when your body can start producing dangerous imbalances that quietly injure blood vessels, interfere with oxygen delivery, and increase the risk of stroke, nerve damage, cognitive decline, and heart complications. And if you are over 60, your body is far more vulnerable to this than it was at 30 or 40. So today I'm going to walk you through exactly which medications create the problem, why this interaction becomes dangerous after 60, the warning signs most people miss completely, and most importantly, what you can do starting today to protect yourself. And trust me, by the end of this conversation, you are going to look at your supplement routine very differently. Before we go deeper, tell me your age and where you are watching from today. I always love seeing where this community is joining from. Now let us start with something most people never hear from their doctor. The human body changes dramatically after 60 in ways that affect vitamins, medications, and nutrient processing all at the same time. This is critical to understand. At younger ages, the body is incredibly resilient. The liver processes compounds efficiently. The kidneys clear excess substances rapidly. The stomach produces strong acid. The intestine absorbs nutrients effectively. The blood vessels remain flexible. But after 60, multiple systems begin slowing down together. Stomach acid production decreases. Digestive absorption weakens. Kidney filtration slows. Liver metabolism becomes less efficient. Blood vessels become more fragile and inflamed. And this means something extremely important. A supplement dose your body handled perfectly at age 40 may behave very differently at age 70, especially when medications are involved. Now, here is where the story gets dangerous. Most seniors do not just take supplements, they take supplements plus prescriptions. And the body does not process those things separately. Everything interacts. Every pill affects the chemistry of every other pill. That includes vitamins. Let me tell you about Richard. Richard was 68 years old, retired engineer, sharp mind, extremely organized. He tracked his blood pressure daily, walked every morning with his wife, took his medications exactly on schedule. And every single morning, he took a high-dose vitamin B12 supplement because he had read online that B12 helped prevent dementia and boosted energy. He believed he was doing something good for his health. What Richard did not realize was that he had also been taking a medication called omeprazole for acid reflux for nearly 11 years. Nobody had ever explained to him what that combination was quietly doing inside his body. Over the previous year, Richard had begun noticing strange symptoms. His legs felt heavier. He became exhausted after small activities. Sometimes he felt tingling in his feet at night. He also noticed occasional pressure in his chest during walks, but his stress test looked normal, so he ignored it. Then one afternoon, while gardening, Richard suddenly became dizzy and confused for several minutes. His wife panicked and rushed him to the hospital, fearing he was having a stroke. Fortunately, it was a temporary ischemic event, what doctors sometimes call a mini stroke. And when they finally did deeper testing, they discovered something shocking. Richard's homocysteine level was severely elevated. His blood vessels showed widespread inflammation, and his B12 metabolism had become profoundly dysfunctional from years of interaction between his supplement and his reflux medication. Richard had spent years trying to protect his brain while unknowingly increasing the stress on the blood vessels supplying it, and his story is becoming more common. Now, let me explain exactly why this happens, because once you understand the mechanism, everything suddenly makes sense. The first medication group we need to discuss is proton pump inhibitors. These include medications like omeprazole, pantoprazole, esomeprazole, and lansoprazole. Millions of adults over 60 take them every single day for acid reflux, heartburn, ulcers, or stomach protection. And to be clear, these medications absolutely have legitimate medical uses, but long-term use changes the digestive environment dramatically. Here is how. Vitamin B12 from food is tightly attached to proteins. Your stomach acid is responsible for breaking those proteins apart so the B12 can be released and absorbed. Without sufficient stomach acid, that release process becomes impaired. Now imagine what happens after years of suppressing stomach acid with a PPI medication. Less acid means less natural B12 absorption. Doctors notice low B12 levels and recommend supplements. The patient starts taking high doses. Blood levels may rise artificially. But inside the tissues, things become far more complicated. Because the body is no longer processing B12 normally, this creates a mismatch between what blood tests show and what the cells are actually receiving. And this is where homocysteine enters the picture. You are going to hear that word several times today because it is one of the most important and overlooked markers in cardiovascular health after 60. Homocysteine is a naturally occurring amino acid. Your body produces it every day. Normally, B12, folate, and vitamin B6 help convert homocysteine into harmless, useful compounds. But when that system becomes impaired, homocysteine starts accumulating. And elevated homocysteine is extremely dangerous to blood vessels. It irritates the delicate inner lining of arteries. It increases inflammation. It promotes stiffness. It makes plaque buildup more unstable. And perhaps most concerning of all, it increases the likelihood that tiny plaques rupture and trigger strokes or heart attacks. Researchers have compared chronic elevated homocysteine to rubbing fine sandpaper repeatedly against the inside walls of your arteries. Not enough damage to notice immediately, but enough damage to weaken the system year after year. Now think about this carefully. Millions of seniors are taking acid-reducing medications for years. Millions are also taking large doses of B12, and almost nobody is testing homocysteine routinely. That means many people believe they are supporting their heart while the vascular system is slowly becoming more inflamed. And the symptoms are subtle at first. That is what makes this so deceptive. You do not suddenly collapse. You simply start feeling older faster, more tired, more mentally foggy, more unstable, more forgetful, more short of breath. Now, let me explain the second medication because this interaction is even more widespread. The second medication is metformin. If you have type 2 diabetes, there is a very high chance you either take it now or have taken it in the past. Metformin is one of the most commonly prescribed medications in the world. It is effective for blood sugar control. But long-term use has a side effect many are never warned about. It interferes with B12 absorption in the small intestine. Specifically, it disrupts calcium-dependent transport systems. It blocks part of the delivery mechanism your body uses. So what happens? The body senses lower B12 availability. The person develops fatigue or nerve symptoms. A supplement gets added, usually a high-dose supplement. But the issue is not simply how much B12 enters the body. The issue is whether the body can actually process and use it correctly. And after years, that system often becomes inefficient. This creates a dangerous paradox. Blood levels can appear normal or high, while the tissues themselves remain functionally deficient. Now, let me tell you about Evelyn. Evelyn was 73 and had been managing type 2 diabetes with metformin for almost a decade. She was incredibly disciplined with her health. Low sugar diet, morning walks, daily supplements, including 5,000 micrograms of B12. Over time, she began experiencing numbness in her toes. Then came balance problems, then memory lapses. She blamed diabetes. Her doctor blamed aging. But when a specialist ordered homocysteine levels, the picture changed completely. Once her supplement form was changed and her nutrient balance corrected, several of her symptoms began improving within months. This is why blindly taking larger doses is not always the answer. After 60, the body becomes more sensitive to imbalance. Here is another important piece. Not all forms of B12 are equal. The most common form is cyanocobalamin. This synthetic form requires multiple conversion steps. Those depend on healthy liver and kidney function, which naturally decline with age. This is why many specialists now prefer methylcobalamin for older adults. It is already in an active, usable form. B12 does not work independently. It works together with folate and vitamin B6. Think of it like an assembly line. If one worker is missing, the whole line slows down. You cannot simply flood the system with B12 if folate or B6 are insufficient. That is why individualized assessment matters so much after 60, not guesswork, real testing, real understanding. In the next part, I am going to show you the warning signs and the exact blood tests you should ask for. I'll see you there. Now, before we continue, I want you to understand something very important. The body rarely sends dramatic warning signs in the beginning when this problem is developing. That is why so many intelligent, health-conscious adults miss it completely. The damage builds quietly, slowly, silently. And because the symptoms overlap with what people assume is normal aging, the real cause often goes undetected for years. This is why I want you to pay very close attention to the next few minutes, because the signs your body gives you are often subtle long before they become dangerous. One of the earliest warning signs is unexplained fatigue that does not improve with rest. Not ordinary tiredness, not the kind where you simply stayed up too late. I mean that strange, heavy exhaustion where your body feels drained even after a full night of sleep. Many adults describe it as feeling like their battery never fully recharges anymore. Here is why this happens. When B12 metabolism becomes dysfunctional, oxygen delivery and nerve signaling efficiency begin declining. Cells are technically alive, but they are not operating efficiently. Your muscles work harder for the same activity. Your brain works harder for concentration. Your heart works harder to circulate oxygen through inflamed, stiffened blood vessels. Everything becomes more effortful. And because this happens gradually, people adapt to it without realizing how abnormal it actually is. Then comes the second warning sign: numbness, tingling, burning sensations, especially in the feet or hands. This is one of the most important symptoms I need older adults to stop ignoring, because nerve tissue is incredibly sensitive to B12 dysfunction. When nerve cells stop receiving proper support, they begin malfunctioning. At first, it feels minor, a little tingling at night, pins and needles while sitting, slight burning in the toes. But over time, the damage can progress upward. Balance becomes unstable. Walking confidence decreases. People begin tripping more often, and many never connect it back to nutrient processing problems because they assume it is simply circulation or diabetes. Now, diabetes absolutely can damage nerves, but dysfunctional B12 metabolism can make that damage dramatically worse, especially in adults taking metformin. In fact, some specialists now routinely screen diabetic patients for functional B12 deficiency. And here is something frightening. Nerve damage from prolonged B12 dysfunction can become permanent if ignored long enough. That is why early recognition matters so much. Now let us talk about the brain, because this is where many families become deeply frightened. Another major warning sign is cognitive change, forgetfulness, brain fog, difficulty concentrating, trouble recalling words quickly, losing track of conversations, walking into rooms and forgetting why you entered. Now, to be clear, occasional forgetfulness happens to everyone. But when cognitive slowing becomes persistent, you should pay attention, because the brain is one of the most metabolically demanding organs in the body. It requires constant oxygen delivery and healthy nerve communication. Elevated homocysteine and dysfunctional B12 metabolism interfere with both. Researchers have found associations with accelerated cognitive decline. Why? Because inflamed blood vessels deliver blood less efficiently, and the tiny, delicate vessels supplying the brain are especially vulnerable. Imagine watering a garden through cracked, stiffened hoses. Eventually, the flowers suffer. That is essentially what happens inside the brain over time. And what makes this even more tragic is that many people assume cognitive decline is unavoidable aging, when sometimes metabolic correction could significantly improve symptoms. Let me tell you about Gloria. Gloria was 76 years old and terrified she was developing dementia. She had become forgetful, lost confidence driving, repeated stories without realizing it, forgot appointments, her family feared the worst. But during a deeper evaluation, doctors discovered severely elevated homocysteine and profound functional B12 deficiency related to long-term medication interactions. Her supplement routine was completely redesigned, her active nutrient levels improved, and within months, several cognitive symptoms stabilized significantly. Now, I want to be very careful here. Not all memory problems are caused by B12 issues. And not all dementia is reversible, but metabolic dysfunction absolutely can worsen cognitive decline dramatically, which is why ignoring it is such a mistake. Now, there is another symptom many people never connect to this issue: shortness of breath, especially during mild exertion, walking upstairs, carrying groceries, gardening. Simple tasks suddenly feel harder. Part of this occurs because vascular inflammation affects circulation efficiency, but another part involves red blood cell production. B12 plays a major role in healthy red blood cell formation. When that process becomes impaired, oxygen transport efficiency declines, and when tissues receive less oxygen, physical endurance drops. People describe feeling weaker, heavier, older almost overnight. Again, not dramatic, just gradual decline. And gradual decline is precisely why these problems hide so effectively. Now, I want to discuss something that surprises many people: mood changes. Because B12 dysfunction does not only affect the body, it affects emotional health too. Low motivation, irritability, anxiety, low mood, emotional flatness. These symptoms can emerge because the nervous system itself is struggling metabolically. Neurotransmitter production becomes less efficient. Stress tolerance decreases. Mental resilience weakens. And older adults often blame themselves emotionally instead of recognizing there may be a physiological component underneath. I have seen patients feel emotionally transformed simply from correcting long-standing metabolic deficiencies and inflammatory imbalances. The body and brain are never separate systems. They influence each other constantly. Because knowledge without action does not protect anybody. The first step is this: stop guessing, please. Do not simply increase or decrease supplements randomly based on internet advice or fear. You need information, real information that starts with proper testing. And unfortunately, standard blood work often misses the real problem. This is one of the most frustrating parts of the entire issue. A routine B12 blood test may look completely normal even while the tissues themselves are struggling. Why? Because standard serum B12 measures total circulating B12, not how effectively your cells are actually using it. That distinction matters enormously to your overall health and metabolic recovery. So here are the tests worth discussing with your healthcare provider if you are over 60, especially if you take metformin, acid reflux medications, or high-dose B12 supplements. First, homocysteine. This is critical. Elevated homocysteine is one of the clearest warning signs that the methylation pathway is not functioning properly. And yet, millions of adults have never had this checked once in their lives. Second, methylmalonic acid, often called MMA. This marker helps identify functional B12 deficiency even when serum B12 looks normal. If MMA is elevated, your cells may not be receiving or utilizing B12 effectively. Third, active B12 testing if available. Not every lab offers it, but it provides a more accurate picture of usable B12 status than total serum B12 alone. Fourth, folate and vitamin B6 levels. Remember, these nutrients work together. Testing only B12 without evaluating the supporting nutrients gives an incomplete picture. Now, here is another extremely important point: timing matters. Many people swallow every supplement and medication together in one handful each morning. But certain medications can interfere directly with nutrient absorption when taken simultaneously. For example, some specialists recommend separating B12 supplementation from proton pump inhibitors by several hours when possible. Why? Because stomach acidity fluctuates throughout the day. Giving the body a more favorable absorption window may improve utilization. This may sound like a small detail, but small details become important after 60 because absorption efficiency is already reduced. Now let us talk about dosage, because this is where marketing often creates confusion. Many seniors believe higher doses automatically mean greater protection. But biology does not always work that way. More is not always better. Sometimes more simply overwhelms the system, especially when intrinsic factor function, kidney function, or metabolic conversion pathways are impaired. For many older adults, moderate targeted doses work better than megadoses, especially when combined with proper cofactor support. And again, the form matters. Methylcobalamin is generally easier for aging bodies to utilize than cyanocobalamin because it bypasses several conversion steps. This becomes particularly important in older adults with reduced digestive efficiency or chronic medication use. Now, there is another major factor I want you to understand: hydration. Because blood vessel health depends heavily on fluid balance. Dehydration thickens the blood slightly and places additional stress on circulation. And here is the problem: the thirst reflex weakens with age. Many older adults are chronically mildly dehydrated without realizing it. That means vascular inflammation caused by elevated homocysteine can become even more problematic. Simple, consistent hydration genuinely matters for your health every single day. Not excessive water intake, balanced hydration throughout the day. Your circulation depends on it. Movement matters too for your blood vessels and your general well being. Blood vessels are living tissue. They respond to activity. Walking improves vascular flexibility, improves circulation, improves insulin sensitivity, supports brain blood flow. And importantly, exercise helps regulate homocysteine metabolism as well. You do not need extreme workouts. Gentle, consistent movement is enormously powerful after 60. Now, let us address something very important emotionally. Many people feel embarrassed when they learn their supplement routine may have been harming them unintentionally. Please do not feel ashamed. You are trying to protect your health. That matters. The real issue is that supplement education has become dangerously oversimplified. People are told vitamins are universally safe and universally beneficial without enough discussion about age, medications, metabolism, kidney function, and interactions. But the human body is more complex than marketing labels, especially after 60. And honestly, many healthcare providers simply do not have enough appointment time to explain these biochemical interactions thoroughly. That is why conversations like this matter, because understanding your body changes everything. Now, let me tell you about Harold. Harold was 81 years old and had survived a mild stroke. Afterward, his daughter became obsessive about researching vascular health. She discovered information about homocysteine and insisted he request testing. His levels were profoundly elevated. He had been taking high-dose B12 while also using both metformin and long-term reflux medication. No one had ever reviewed the combination comprehensively. His care team adjusted his supplementation strategy completely. They changed the form of B12, reduced the dosage, added methylated folate and B6 support, improved hydration, encouraged regular walking, and monitored his blood work closely. 6 months later, his homocysteine levels had fallen dramatically. His energy improved, his walking endurance improved, and perhaps most importantly, his daughter finally felt like they understood what had actually been happening inside his body. That knowledge gave them control again, and that is what I want for you too. Control, understanding, awareness, not fear, because fear without understanding helps nobody, but informed action can genuinely change outcomes. So let me give you a simple summary of what I most want you to remember from today. If you are over 60 and taking vitamin B12, especially high-dose B12, you must pay attention to the medications you are combining it with. Metformin can interfere with B12 absorption and utilization. Proton pump inhibitors can reduce the stomach acid necessary for proper B12 processing. Both can contribute to elevated homocysteine levels when the system becomes imbalanced. Elevated homocysteine damages blood vessels silently over time and increases cardiovascular and neurological risk. Symptoms may include fatigue, numbness, brain fog, memory problems, balance issues, weakness, mood changes, and reduced endurance. Standard blood tests often miss the deeper problem. Testing homocysteine, methylmalonic acid, active B12, folate, and B6 provides a far more complete picture. The solution is not eliminating B12. The solution is smarter supplementation, smarter testing, smarter dosing, and smarter conversations with your healthcare provider. And please remember this: your body after 60 deserves precision, not guesswork. If this conversation helped you understand something you had never been told before, share it with someone you love. because there are millions of older adults taking these combinations right now without realizing the risks. And one conversation could genuinely protect somebody from years of silent vascular damage. Thank you for spending this time with me. Take care of your heart, take care of your brain, and most importantly, never stop learning how your body truly works.